Hey, have you been suffering with sciatica problems for months now? Are you looking for real long-term relief? Well, in this video today, I'm going to give you 3 expert tips, including 3 exercises that you can do right now at home to begin to improve your sciatica problem for the long term. Real quick, my name is Dr. David Midoff, and I'm a specialist physical therapist. I've been helping out people with sciatica problems for years, and we're pretty darn good at it. Now, there's 3 exercises that I give our clients frequently, and I'm going to go over those with you today so that you can start doing those at home for your sciatica problem to get true long-term relief of this issue. And I'll tell you about situations where you might need to get some expert help too, just to make sure that you fix any joint problems or any problems that you can't really fix at home. But these 3 exercises that I'm going to show you are pivotal in making sure that you get long-term relief for your sciatica problem. The first big tip that I want to give you is you've got to avoid stretching your sciatic nerve. Now, there's tons of ways that people do this. I'm going to show you just a couple of the quick common things that people do to stretch their sciatic nerve. They look like this. The 2 most common stretches. People will lie down on their back, cross one leg over the other, and then pull their knee up into their chest or towards their head this way to stretch this part out, because that sciatic nerve travels through the leg this way. And you'll feel a big stretch doing this. And the problem with doing this is when you get that stretch, it's feedback. It tells your body you're doing something. But the truth is, if you've got a real irritated sciatic nerve, it's going to irritate it further. In another video, I go into a lot of detail about why stretching is bad for sciatic nerve problems. Check out the link in the description below to get to that video. Another stretch that's commonly done to stretch out the sciatic nerve is people will do this. They'll just reach towards their toes. People might do it in standing as well, where they're standing up and just bending over, but the same idea is there, where you're reaching your feet with your hands. And the problem with this is you're stretching your sciatic nerve this way, and nerves just don't like stretching. I go into it in detail in that video. Check out that link for that video in the description below here. But the main message I want to leave you with today on this video is, if you're stretching your sciatic nerve anyway, even if it's different than the ways that I just showed you, you've got to look at avoiding doing that. The only time I tell people go ahead and do it is if you're just at a crossroads where you're like, all right, I'm either going to take this medication, which I really don't want to do, or I'm going to do a stretch. It's kind of up to you what you want to do at that point. But I wouldn't look to stretching as a long-term solution to fix your sciatica problem. That just isn't the case. It's a short-term solution. Now, the second tip I want to leave you with today for sciatica relief for the long term is to move. You've got to move. Now, this is based on whatever is in your tolerance for movement, because if you're really severe with your sciatica problem right now, then a lot of movement may not be a good idea for you. You got to do what you can without flaring up your problem too much. We get people that come in here to the clinic and they're just hunched over, they can't straighten up. If you're in that situation, you got to probably do movement in a seated position or lying down position, but you've got to move somehow. It may be some exercises, it may just be doing some chores or something simple. You may be folding the laundry, sitting down at your couch or at your chair, wherever you are. You've got to keep up with your life a little bit at least, because that movement is critical to move your nervous system. All your nerves within your body, including that sciatic nerve, need movement. The worst thing you can do is just sit there and do nothing for a long period of time, because that will actually make your nerves worse over the long term. A lot of people that come in here with sciatic problems are just sitting around trying to let it calm down, and it will kind of calm down a bit if you sit around, but then your nerves will tighten up. Nerves have a certain amount of flexibility. When they get irritated, they shorten, and then if you don't move a whole lot after that, they shorten even more. You want to make sure your nerves have good length so that they can begin to move better and you can recover from your sciatica problem for the long term. So if you're sitting right now and you've been sitting for a while, you got to get up and start moving. Do what you can without flaring up that sciatica problem too much. Now, the third tip I want to give you is butt exercises. You have to get stronger in your butt muscles. And what I want to just differentiate, what I want to talk about the difference between for you is there's a difference between high repetition cardio type exercises, like where you're moving consistently for several minutes, maybe 10, 15, 20 minutes. Like if you were to get on a treadmill or a bike, or an elliptical or something similar, or rower is another option. That's good for increasing the amount of reps you can do, being able to keep your glutes moving for a period of time. What I'm talking about though is strengthening, like gaining more strength, increasing the amount of strength that you can put in through a muscle, the amount of power that you can put in through a muscle. There's a few exercises I'm going to take you through right now to show you how to begin to get that strength. But for the long term, you've got to increase your strength and keep it up high to prevent this sciatica problem from coming back. So I'm going to give you just the quick progression, what you should do. And the first exercise I'll show you is just like the beginner exercise. You might hang out there for a week or two. It just depends on your current strength level and irritation in your sciatica problem. The second exercise is kind of the next step. You might do it along with the first one. And then the last exercise I'm going to give you, that third one, is definitely a higher level exercise. I would make sure you're good at the first two exercises before moving on to that third exercise. Now, just a quick side note before we get too late on this. If you're planning on following this little quick routine for your sciatica problem so that you can get that long-term relief, you might just bookmark this page that you're on, this YouTube video, so that you can come back to it in case you forget which exercise comes next. So just reminding you to do that now. All right, let me show you the first exercise. So we're gonna do bridges, and I need you to do it just like this. So you're gonna be lying on your back, on your bed, on the floor, wherever you want. You gotta push your back flat so that your abs tighten up here. So you're pushing this part down, and then you're gonna squeeze your butt muscles. So you should feel them tighten up right there, holding the back flat, abs tight, and then your butt muscles tight. You're gonna lift up and start to hold it here. And the hold is really important because it starts to wake up all those muscle fibers, all the cells in your butt muscles that haven't been used properly over the past months or years or however long it's been for you to develop this sciatic problem. After about 10 seconds, you can come down and relax, and you're gonna repeat this 10 times. So back flat, butt tight, lift up, and do a slow 10 counts. And you should be feeling these butt muscles working really hard. Now, what I want you to think about is a lot of people start getting spasms here, or Charlie horses, cramps, that kind of thing. You want to avoid that. The way that you can avoid it is by making sure that your butt muscles are doing the majority of the work. You shouldn't feel like your hamstrings are doing a lot of work. So if you're going through the setup for the exercise where you're pushing your back flat and then squeezing your butt, you need to make sure that when you do the squeeze your butt part, that it's tight, it's hard as you can, because then when you start to lift up, you're going to be using these butt muscles rather than the hamstrings. And if you feel like you're just really dominant, like you want to use your hamstrings, don't even lift. Just start with a modified version of this where you just back flat, butt tight, and just get good at tightening up your butt without trying to fire your hamstrings so much. Another tip is open up your knees. That tends to fire your butt muscles a bit more. So I would work at waking up those butt muscles, holding it for 10 seconds here to get all the fibers, all the muscle cells in your butt working hard. Now the second exercise I'm going to show you requires you to have already good control over your butt muscles. So if you just can't quite get them to turn on, because that happens a lot in people with sciatica problems, they just don't even use their butt muscles. They're almost unaware of being able to fire them. But once you've got that down, you use that bridge exercise to get them going, then here's the next exercise that you want to do. It's called a butt blaster. So you're going to get on all fours, just like this. You can put your hands however you want. And another version of this, they call it the donkey kicks, same thing. What you got to do is, again, tighten up your abs. That helps you to make sure that your back is stable and that you're not moving in a funky way that could hurt your back. And then once you got your abs tight, you're going to keep your knee bent and squeeze your butt as you bring your foot up towards the air. And you're just gonna do reps like this. I would go, if you can get to 100 reps, that'd be fantastic. You might start at 20 or 30 reps, work your way up to 50, and eventually work your way up to 100. And every time you come up, you need to be squeezing that booty muscle. You might alternate sides. It doesn't really matter how you do this exactly. If you want to go one left, one right, or 10 on the left, 10 on the right, or just do them all on one side and then do the other side. It doesn't matter. You just got to get those butt muscles moving and strong. And you should be squeezing pretty darn hard.
every time you're about to lift. Like right here, when I'm about to pick up my leg, I'm already thinking about squeezing my left butt cheek as this knee is coming off the table here. And then as I drive my foot upwards, my butt muscle is squeezing as hard as it possibly can. And what you want to avoid is twisting in your back a lot. That's why you keep your abs tight, so that you're not doing a lot of back motion while bringing your foot up. And as you can see, I'm not bringing my foot that high. If I were to twist, I can get way higher. But the point here is not to twist my back, it's to strengthen my butt. So I want to make sure that my butt muscle tightens up quite a bit. So that's the second exercise that you'll be doing. Now those first two exercises, you might spend some decent time there. It just depends on how severe your sciatic problem is and how weak your butt muscles are. If you're quite weak and you're just not confident that you can do much more on your butt muscles, just hang out on these two exercises for a while. Remember, you're going to want to bookmark this video so that you can come back to this third exercise. This third exercise does require you to have some decent strength in your butt muscles, as well as be able to just fire your butt muscles on command. Now, just a side note, kind of a weird thing, but it really helps. If you've got the ability to squeeze each butt cheek independently, like you can do left, right, left, right, left, right, then you're ahead of the game. You've got some good butt control, and you're probably going to progress through these exercises a bit faster. But if you're the type that you're like, holy cow, I can't do that, that's too weird for me, get good at starting to do that and use these two exercises that I just showed you to get that control over your butt muscles to where you can fire them on command. You've literally got to get a better brain connection to your butt muscles and be able to fire them independently and on command so that you can do this next exercise appropriately. All right, let's go into exercise number 3 here. This is the one that you're gonna take yourself to the next level on. Make sure that your strength actually goes up. The past 2 were mainly to wake up the butt muscles and get all the little cells, all the fibers, be able to use 100% of them, because muscles do shut down if you're not using them appropriately. They will weaken and they won't give your joints and your muscles and all the other tissues the support they're supposed to give them. So you've got to make sure that you're using all the fibers. So you can do a squat here. Now I'm gonna mainly show you my hips, so you need to be able to see my hips here. You're gonna be in a comfortable stance. It doesn't matter if you're, how wide your feet are too much. Generally, the about shoulder hip width apart is a good place to start. And you want to angle your toes out slightly. Just make sure they're not straight forward. You want to just slightly angle them out. And I'm showing you a side view here because I need you to see my hips and my lower back. Just like we did on the bridge, where you flattened out your back and tightened up your butt, you got to do the same thing here. So in the standing position, you're going to flatten out your back, squeeze the butt muscles, and this is the top position of the squat. Now your knees might be slightly bent. That's okay. That's actually not a bad thing at all. But suck those abs in, squeeze the butt, and then what you're going to do next is descend or go straight down as if you're dropping your butt right between your heels. So it looks like this. I've got to keep my back straight and go straight down. And right here, I'm firing butt muscles. It doesn't feel like I'm firing much else. A little bit in my thighs, but mainly butt muscles. Then come back up and squeeze the butt pretty hard. When you come down, you don't have to go down low. You just have to go down what's comfortable with your butt still firing. So if I go down to about right here, I feel my butt working pretty hard. But as I go down lower, butt starts to turn off just a bit. It's still working, but my thighs are engaging a bit more. So I'm going to come up out of there at that position. You don't have to go down super low. So down nice and wide with the knees, and then up and tighten up. Down wide with the knees, and then up and tighten up. What you want to do here is start out with about 20 reps, slow, controlled. You've got to control your back position and make sure that your butt's working the whole time. As you get more and more comfortable with this, then you can go a little faster, and I would definitely climb up in reps. A great goal to have to make sure that your sciatica problem goes away for the long term and that you keep it away is to be able to do 50 to 100 reps, somewhere in that range, while still using your butt muscles. Now let me show you the wrong way to do this, because everybody makes this mistake. They set up right, and then instead of dropping straight down, especially as they get higher in reps, like once they're into the 50s and beyond, they start to hinge too much. They start to bring their chest and shoulders down and stick their butt backwards. If you're using your butt as a targeting, you're aiming with your butt,
You don't want to aim for behind you on the floor or at the wall behind you. You want to aim straight down. So your butt should be dropping straight down when you come down and then squeezing when you come up. And I have people do this exercise sometimes, even just mild, where they're just doing a little baby bend like this and then coming up. And that's okay, as long as you feel like your butt muscles are working. Remember, the biggest thing about all these exercises, this is the main expert tip point that I want to leave you with, is you've got to strengthen your butt muscles. That's just it. The reason for it, I'm bringing my skeleton here, in a sciatica problem, that sciatic nerve pops out right here and it goes down into the leg. This is the butt area right here. The glute, the butt muscles, they wrap over this area and attach to the tailbone, and they give the joint between the tailbone and this pelvis bone lots of stability. And in most cases of sciatica, this pelvis bone out here is shifting in some way, putting pressure on this poor sciatic nerve, because the bone around it, and there's a ligament right here, can compress it and cause that sciatica issue. Now, there could be other issues up in the lower back. There could be issues down in the hip and into the knee, even into the foot contributing to this. But what I see is, by and large, a lot of sciatica patients that we see here are dealing with some shift in their pelvis, and it's because the glute strength out here is not good enough to keep this bone in the position that it should be. So it is critical that you strengthen your butt muscles. Well, guys, I want you to give these exercises a shot. Let me know how it goes for you. Drop a comment right down here below to let me know if they're working out for you. And if you get to those squats, if you end up progressing yourself through the first two exercises, and then you get to that third exercise, you're doing a squat, let me know how the squats work out for you as well. I'm really interested to know how these exercises are working for you, so please drop a comment for me. And make sure to check out that video that I dropped the link in the description for about why stretching makes sciatica problems worse, so that you can have a full understanding about why you need to exercise, specifically the glute muscles, and why you should avoid stretching. Because if you're doing stretching and trying out these exercises, you may be working against yourself. So it's good for you to have a good understanding about why you shouldn't be stretching. Hey, if you're thinking that you might need to hire us to help you for your specific sciatica problem because you're just not quite getting these exercises right, or you're afraid that you might do something wrong and hurt yourself, or you're still having some issue with the sciatica problem, whether it's in your back or your hips or somewhere else where the sciatic nerve travels, and you want to get some hands-on help, some expert help in person, then what I recommend you do is scroll down to the bottom of this page and find the button that says request a free 20-minute discovery visit. That button will pop up a little window where you can leave us your details. And what we can do for you is give you a completely free discovery visit, which is a 20-minute appointment with a specialist physical therapist, where we can check out your sciatica problem in person or virtually, and we can see you over the camera. We use Zoom or Google Hangouts, one of those video softwares, and we can diagnose the problem and begin to formulate a plan to resolve your sciatica problem for the long term. There's nothing to lose. This is a completely free visit. And there's no commitment. If you decide you don't want to work with us, cool. Our responsibility to you is just to make sure that we give you all the information that you need about your sciatica problem so that you can make the best decision moving forward about it. But I sure hope we can be a part of your success story. Please take advantage of this offer. Go down to the bottom and hit that discovery visit request button. Or another option for you is to also just call us. Our phone number's at the top of the page here, or I'll give it to you here. It's 915-503-1314. And when you talk to one of my staff, they'll be asking you questions about your sciatica problem, because we just want to make sure that we don't waste your time, that it's a type of sciatica problem that we can really help out here in the clinic so that you can get that long-term relief and avoid having to suffer with the sciatica problem and possibly having unnecessary surgery, injections, or rely on pain medications without finding a true cure for this problem, which is exactly what we do here for sciatica issues. I hope you have a wonderful day. Bye-bye.